Oral hygiene is one of the most overlooked yet most crucial aspects of health, particularly as people age beyond 70. At this stage of life, the body becomes more sensitive, the immune system less resilient, and healing processes significantly slower. That means something as seemingly small as neglecting daily mouth and teeth cleaning can set off a cascade of health issues that affect not only the mouth but the entire body. When someone keeps their mouth clean, brushes and flosses regularly, and pays attention to oral health, they are not just protecting their teeth from decay or their gums from disease. They are also safeguarding their heart, brain, digestive system, and overall well-being. The mouth is the gateway to the body, and the bacteria that live there can either stay balanced and harmless or, if left unchecked, turn into dangerous invaders that cause infections and chronic inflammation. After 70, many people experience a natural decline in saliva production. This condition, often called dry mouth, is partly caused by aging itself and partly by the medications seniors frequently take for blood pressure, diabetes, or other chronic illnesses. Saliva is nature's cleanser for the mouth. It washes away food particles, neutralizes acids, and helps maintain a healthy balance of bacteria. When saliva decreases, the mouth becomes more vulnerable to plaque buildup, tooth decay, and bacterial overgrowth. Daily cleaning of the teeth and gums becomes essential because the natural defenses are no longer as strong as they once were. Brushing twice a day and flossing are no longer just routine habits. They become necessary acts of protection that replace what the body can no longer do on its own. One of the biggest dangers of poor oral hygiene in seniors is gum disease, also known as periodontal disease. In the early stages, it may show up as bleeding gums when brushing or slight swelling, but if ignored, it can progress into severe infection, gum recession, and tooth loss. For an elderly person, losing teeth is not only painful and emotionally difficult, it can also severely restrict diet. Without strong teeth, chewing becomes difficult, leading many seniors to avoid nutritious but harder foods like fruits, vegetables, and lean meats. This can trigger malnutrition, weight loss, and overall weakness. Therefore, daily cleaning of the mouth is not just about fresh breath, it is directly tied to maintaining the ability to eat a healthy diet that supports longevity and vitality. Beyond local effects, poor oral hygiene has been strongly linked with serious systemic diseases. Bacteria from the mouth can enter the bloodstream through tiny openings in the gums, especially if gum disease is present. Once in the bloodstream, these bacteria can travel to the heart and contribute to endocarditis, a dangerous infection of the heart's inner lining. They can also promote the buildup of plaque in arteries, increasing the risk of heart attacks and strokes. For elderly individuals, who may already be dealing with cardiovascular concerns, this connection is especially alarming. Cleaning the mouth daily reduces bacterial load, preventing such dangerous spread and offering an added layer of heart protection. Another critical aspect is the connection between oral health and brain health. Emerging studies have shown that the same bacteria responsible for gum disease have been found in the brains of patients with Alzheimer's disease. While research is still developing, many experts now believe that chronic oral infections may contribute to cognitive decline by fueling inflammation in the brain. For seniors striving to maintain mental sharpness and protect themselves against dementia, keeping the mouth clean each day could play a surprisingly powerful role. Brushing, flossing, and even using an antibacterial mouth rinse can keep bacterial levels under control and reduce risks that go far beyond cavities. Elderly people also face a higher risk of respiratory infections like pneumonia, especially those living in nursing homes or with limited mobility. Poor oral hygiene can increase this risk because bacteria in the mouth can be inhaled into the lungs during breathing, particularly at night. This is why doctors often stress the importance of mouth cleaning for bedridden or dependent seniors. A simple daily routine of brushing teeth and cleaning the tongue can dramatically reduce the risk of aspiration pneumonia, which is a leading cause of death among older adults. It highlights how something as simple as oral hygiene can have life or death consequences at this stage of life. Daily oral care also supports social and emotional health. Seniors often feel embarrassed about bad breath, discolored teeth, or missing teeth, which can lead to social withdrawal. Loneliness is already a major challenge for people over 70, and poor oral hygiene only deepens the problem. On the other hand, maintaining clean teeth, fresh breath, and a healthy smile boosts confidence and makes social interactions more enjoyable. Smiling and speaking without self-consciousness improves mood, reduces isolation, and contributes to mental well-being. In this way, brushing teeth each day is not only about physical health but also about maintaining dignity and self-esteem. The methods of cleaning also matter. For seniors, using a soft bristled toothbrush is often recommended to protect sensitive gums. Electric toothbrushes can be especially helpful for those with arthritis or hand tremors, since they do most of the work and ensure thorough cleaning even when manual dexterity is limited. Flossing remains important, though some may prefer floss picks or water flossers if traditional floss is difficult to use. Cleaning the tongue is another overlooked practice that can reduce bacteria and freshen breath. For those with dentures, daily cleaning of the prosthetics is just as critical, because bacteria and fungi can accumulate on dentures and cause infections like oral thrush. Whether natural teeth, implants, or dentures, the principle remains the same: clean every day without fail. Hydration also plays a role in maintaining oral health. Seniors often forget to drink enough water, which worsens dry mouth and allows bacteria to multiply. By drinking adequate fluids and rinsing the mouth after meals, they can support the natural cleansing process. Sugar intake should also be limited, since sugar feeds harmful bacteria that erode teeth and inflame gums. For those with medical conditions like diabetes, oral hygiene becomes doubly important, because diabetes and gum disease reinforce each other in a dangerous cycle. Keeping the mouth clean helps keep blood sugar levels more stable, which in turn supports overall health. Professional dental visits are another important part of oral hygiene, but daily self-care is the foundation. Even if seniors see a dentist once or twice a year, it is the daily brushing and cleaning that makes the real difference. Skipping this daily routine allows bacteria to grow rapidly, undoing the benefits of occasional checkups. Think of it as maintaining a garden. A gardener who weeds a little every day keeps the garden healthy, but if they ignore it for weeks and only fix it once in a while, the weeds overtake everything. The same is true for the mouth. In the end, oral hygiene after 70 is not a cosmetic luxury or a minor detail, it is a central pillar of health. Every stroke of the toothbrush, every flossing motion, every rinse with water or mouthwash is a small investment in longevity and quality of life. It helps keep the heart strong, the brain sharp, the body nourished, and the spirit confident. It prevents suffering, avoids unnecessary medical bills, and supports independence in daily living. For seniors and their caregivers, making oral hygiene a daily non-negotiable habit is one of the simplest yet most powerful steps toward graceful and healthy aging. It may take only a few minutes each morning and night, but those minutes add years of vitality, comfort, and dignity to life. Private area cleanliness becomes increasingly important as people age, and after 70 it is no longer just about comfort or routine. It is about preventing serious health problems that can quickly escalate in the elderly. The body's natural defenses weaken over time, skin becomes thinner, and the immune system responds more slowly to infections. At the same time, mobility may decrease, making hygiene more challenging. These changes create an environment where bacteria, fungi, and other microorganisms can thrive if daily cleaning is neglected. The private areas of the body, genital and urinary regions, are particularly vulnerable because they are warm, moist, and often confined, creating perfect conditions for infection. By maintaining cleanliness each day, seniors can protect themselves from urinary tract infections, skin irritations, unpleasant odors, and more serious complications that may even affect the kidneys and overall health. Urinary tract infections, commonly known as UTIs, are one of the most frequent medical issues among older adults, especially women. In women, the urethra is shorter, which makes it easier for bacteria to enter the bladder. After menopause, lower estrogen levels further weaken the natural protective barriers in the urinary tract. For men, prostate issues can interfere with bladder emptying, which increases the risk of bacteria multiplying in retained urine. At any age, a UTI can be uncomfortable, but in seniors it can be especially dangerous. Symptoms like burning during urination, frequent urges to urinate, or cloudy urine may appear, but sometimes older people show only vague signs like confusion or sudden weakness. This is why prevention is far more effective than relying on treatment after the fact. Daily washing of the private areas helps remove bacteria before they travel into the urinary system, reducing the risk of infection at its source. Skin irritation is another major concern. With aging, skin loses elasticity and becomes thinner, more fragile, and less able to recover from minor friction or moisture exposure. When the private area is not cleaned properly, sweat, urine droplets, or discharge can accumulate, irritating the skin and leading to redness, itching, or painful rashes. Prolonged exposure to moisture, often called moisture-associated skin damage, can also create open sores that serve as entry points for infection. For bedridden or less mobile seniors, this problem becomes even more pronounced, as sitting or lying for long periods without proper hygiene care can result in pressure sores or infections in sensitive areas. Regular, gentle cleaning prevents these issues by keeping the skin dry, fresh, and less prone to breakdown. Fungal infections also thrive in poorly cleaned private areas. Warm, moist environments provide ideal conditions for fungi like Candida to multiply, leading to yeast infections. These can cause intense itching, burning, and discharge, making everyday activities uncomfortable or even unbearable. In older men, fungal infections can occur under the foreskin or in folds of skin, especially if mobility is limited and hygiene is not consistent. For both men and women, controlling moisture and maintaining daily cleaning routines are the simplest ways to prevent fungal overgrowth. Using mild, unscented cleansers and ensuring the area is thoroughly dried after washing can keep fungal problems at bay. Odor is another issue that affects not only physical but also emotional well-being. Seniors who struggle with incontinence or reduced mobility often worry about smelling unpleasant. Even slight neglect of cleanliness in the private area can result in noticeable odor, which may cause embarrassment, social withdrawal, and a decline in confidence. This can contribute to isolation, one of the greatest challenges in old age. By committing to daily hygiene, seniors maintain not only their health but also their dignity, comfort, and willingness to interact socially. Something as simple as feeling fresh and clean can make a significant difference in overall quality of life. Another often overlooked factor is the connection between private area hygiene and kidney health. Repeated or untreated urinary tract infections can travel upward from the bladder to the kidneys, causing a more severe infection known as pyelonephritis. In elderly individuals, this condition can quickly become life-threatening, requiring hospitalization and strong antibiotics. Since the initial cause often comes from bacteria near the private areas, the simplest preventive measure is regular daily cleaning. By keeping the source area free of bacterial buildup, the likelihood of infection spreading to the bladder or kidneys is greatly reduced. For seniors with incontinence, the importance of private area hygiene multiplies. Urine and stool in contact with the skin for even short periods can cause irritation, breakdown, and infection. Wearing protective pads or diapers may be necessary, but they must be changed frequently and followed by proper cleaning of the area. Otherwise, the trapped moisture and waste become a breeding ground for bacteria and fungi. Incontinence-related skin damage is not only uncomfortable but can spiral into serious infections that require medical treatment. Gentle cleansing with warm water and mild soap, followed by drying and application of protective creams if needed, helps maintain skin integrity and health. Men face unique challenges as they age. Enlarged prostate glands can make urination more difficult, leading to dribbling or incomplete emptying of the bladder. Without proper hygiene, this can cause lingering moisture and bacteria around the private area, raising the risk of infection and odor. For uncircumcised men, daily cleaning beneath the foreskin becomes especially important, as smegma buildup can irritate the skin and harbor harmful bacteria. Ignoring these steps may not seem serious in the short term, but over time the risks accumulate and result in painful or dangerous conditions. Women also face specific concerns. After 70, vaginal tissues often become thinner and drier due to hormonal changes. This makes them more sensitive to irritation and infections. Daily gentle washing of the external genitalia, without using harsh or perfumed products that disrupt natural balance, helps protect against discomfort and infections. Women with pelvic organ prolapse or who have had surgeries may find hygiene more challenging, but it is precisely in such cases that extra care is necessary. Proper hygiene in these situations helps maintain comfort and reduces the chances of complications. Psychological well-being is another dimension of private area cleanliness. Many seniors who maintain good hygiene feel more in control of their bodies, even as aging brings challenges. The sense of freshness and cleanliness contributes to mental peace and dignity. Conversely, those who neglect this area may feel ashamed or anxious, particularly if they live with family or in care facilities. This emotional burden can reduce self-worth, worsen depression, or increase dependence on others. Taking just a few minutes daily for private area hygiene can thus empower seniors to feel independent and confident, reinforcing their overall sense of well-being. Proper technique also matters. Elderly individuals should be encouraged to use warm water and mild, fragrance-free soap for cleaning, avoiding harsh chemicals that strip natural oils or irritate sensitive skin. Rinsing thoroughly and drying gently with a soft towel is essential, because leaving moisture trapped in folds of skin can undo the benefits of cleaning. For those with limited mobility, caregivers should be trained to handle hygiene care respectfully and gently, maintaining the senior's dignity at all times. Even small tools like handheld bidets or wipes designed for sensitive skin can make hygiene easier and more effective. Ultimately, daily private area hygiene after 70 is not simply about routine cleanliness. It is about preserving health, preventing serious medical conditions, protecting dignity, and ensuring quality of life. By paying attention to this delicate area, seniors can avoid infections, hospitalizations, and discomfort while enjoying the benefits of freshness, comfort, and confidence. It is one of the simplest yet most powerful acts of self-care for the elderly, with effects that ripple through physical, emotional, and social health. Just as brushing teeth guards the heart and brain, cleaning private areas daily guards the urinary system, skin, and kidneys, ensuring that seniors can continue to age with strength and dignity. Feet are often taken for granted, but after the age of 70 they demand careful daily attention and cleanliness. At this stage of life, feet carry not only the weight of the body but also the wear and tear of decades of movement. They are the foundation for mobility, balance, and independence. Neglecting foot hygiene can lead to infections, pain, circulation problems, and mobility issues that quickly diminish quality of life. Clean feet are not just about appearance. They are about protecting the body's stability, preventing falls, and avoiding complications that can become life-threatening in the elderly. By cleaning the feet daily, seniors can ward off fungal infections, improve circulation, protect fragile skin, and maintain the ability to walk with confidence and comfort. One of the most common issues in neglected feet is fungal infection, especially athlete's foot. Fungi thrive in warm, moist environments, and the spaces between the toes are perfect breeding grounds when not kept clean and dry. Athlete's foot causes itching, burning, cracking, and peeling, which may seem like small inconveniences but can quickly become severe in seniors with fragile skin. If left untreated, the infection can spread to toenails, causing thickened, brittle, and discolored nails that are painful and difficult to trim. For elderly people, who may already struggle with bending or reaching their feet, nail fungus becomes a persistent problem that can only be avoided with daily cleaning and drying. By washing feet with mild soap, rinsing thoroughly, and ensuring moisture is removed from between the toes, seniors can stop fungal infections before they start. Bacterial infections are another danger. Small cuts, blisters, or cracks in the feet can easily become infected if the feet are not kept clean. With age, skin loses elasticity and becomes thinner, making it more susceptible to injury. Seniors with conditions like diabetes face an even higher risk, because high blood sugar levels slow healing and reduce the body's ability to fight infection. For a diabetic senior, a small sore on the foot can escalate into a serious ulcer that may require hospitalization or even amputation. If neglected, this makes daily foot hygiene not just a comfort measure but a vital act of prevention. By carefully washing and inspecting the feet each day, seniors and their caregivers can spot minor issues early and address them before they turn into dangerous problems. Circulation issues are also common in older adults, and feet are often the first place to show signs. Swelling, numbness, or coldness in the feet can indicate poor blood flow. When circulation is compromised, it becomes harder for the body to fight infections and heal wounds. Daily cleaning of the feet, combined with gentle massage during drying, stimulates blood flow and keeps tissues healthier. Even the simple act of moving hands across the feet while washing or drying helps improve circulation. This is particularly important for seniors who are less mobile or spend long periods sitting, as inactivity worsens circulation problems. Clean, stimulated feet are healthier feet, capable of carrying the body more effectively. Foot odor is another issue that affects both physical and emotional well-being. Odor is often caused by bacteria breaking down sweat, and without proper cleaning, the smell can become persistent and embarrassing. Seniors who worry about foot odor may withdraw from social situations or avoid removing their shoes in public, even at family gatherings. This creates unnecessary self-consciousness and isolation. By keeping feet clean, wearing fresh socks, and ensuring shoes are dry and well ventilated, odor can be prevented. This small daily act helps maintain confidence, dignity, and ease in social interactions, which are essential for mental and emotional health in old age. Balance and mobility are directly linked to foot health. Dirty, neglected feet are more prone to infections, calluses, corns, and thickened nails, all of which cause pain when walking. Pain in the feet often leads to compensatory changes in gait, which can increase the risk of falls. Falls are one of the most serious threats to elderly independence, often leading to fractures, long hospital stays, or permanent disability. Clean, healthy feet are comfortable feet, and comfortable feet support safe walking. For seniors, avoiding even minor discomfort in the feet makes a huge difference in maintaining balance, independence, and freedom of movement. Daily foot hygiene also provides an opportunity for inspection. Many seniors may not notice developing problems like swelling, discoloration, or sores until they become serious. But by cleaning the feet each day, one is forced to look closely at them. This allows early detection of conditions like fungal infections, ingrown toenails, or diabetic ulcers. Catching these problems early makes treatment easier and prevents complications. Caregivers, too, can use daily foot cleaning as a chance to monitor the health of an elderly person's feet, ensuring that any warning signs are addressed promptly. Proper technique is essential for foot hygiene. Seniors should wash feet with warm water and mild soap, avoiding water that is too hot because aging skin is more sensitive and burns more easily. Scrubbing should be gentle to prevent damage to delicate skin. Special attention must be given to the spaces between the toes, as these are areas where moisture often lingers and infections begin. After washing, thorough drying is critical. Dampness is the enemy of healthy feet, and simply leaving water to air dry invites fungal and bacterial growth. A soft towel should be used to carefully dry every crevice, ensuring the feet are completely dry before socks or shoes are put on. Moisturizing is another key aspect of elderly foot care. While it may seem contradictory to dryness prevention, moisturizing prevents skin from becoming too dry and cracking, which can lead to infections. The trick is to moisturize the tops and bottoms of the feet but avoid applying lotion between the toes, where moisture buildup could encourage fungal growth. This balance keeps the skin soft, flexible, and less prone to damage while still protecting against infection. Footwear also plays a role in cleanliness. Clean feet quickly become dirty again if placed into unwashed socks or damp shoes. Seniors should change socks daily, choosing breathable fabrics like cotton that wick moisture away from the skin. Shoes should be aired out regularly, and those that trap heat and sweat should be avoided. For those with mobility issues, slip-on shoes with proper support can make hygiene easier and reduce the effort required to maintain foot care. Proper footwear, combined with daily cleaning, creates a holistic approach to foot health. The emotional and psychological benefits of clean feet should not be underestimated. Seniors who take care of their feet often feel more comfortable, dignified, and in control of their bodies. Clean feet allow them to move without embarrassment, enjoy activities like walking or visiting others, and maintain independence for longer. Conversely, foot problems can confine seniors to their homes or beds, limiting mobility and contributing to loneliness and depression. By maintaining daily hygiene, seniors safeguard not only their physical health but also their sense of freedom and self-worth. Ultimately, foot care after 70 is about much more than avoiding odor or dirt. It is about protecting mobility, preventing life-threatening infections, ensuring circulation, and preserving independence. Feet are the base of the body, the foundation for every step, and their health reflects on the health of the entire person. Seniors who wash, dry, inspect, and care for their feet daily give themselves the gift of comfort, confidence, and security. It is a simple habit that requires only minutes but can add years of quality life by preventing problems that rob older adults of mobility and dignity. Clean feet are healthy feet, and healthy feet mean freedom, vitality, and resilience even in the later stages of life. Daily hygiene may seem like a small routine, but for people over 70 it plays a powerful role in preserving confidence, comfort, and overall quality of life. At this age, the body is more vulnerable, the skin is more delicate, and infections spread more easily. Many seniors live with health conditions that limit energy or mobility, making hygiene feel like a challenge rather than a simple habit. Yet those who maintain daily cleanliness experience not only fewer physical problems but also a stronger sense of dignity, independence, and well-being. Cleanliness is not just about removing dirt, it is about feeling good in one's own skin, presenting oneself proudly to others, and keeping both body and spirit in balance. Confidence is often underestimated when talking about hygiene. For seniors, confidence can mean the difference between withdrawing from social life or engaging fully with family and friends. When an older person feels clean and fresh, they are far more likely to join conversations, attend gatherings, or interact with grandchildren without fear of bad breath, body odor, or visible signs of neglect. This social participation is critical, because isolation is one of the biggest threats to mental health in old age. A senior who avoids contact due to embarrassment over hygiene can fall into loneliness and depression, which in turn harms physical health. On the other hand, someone who practices daily hygiene feels comfortable being around others, carries themselves with pride, and radiates self-assurance. This emotional strength encourages meaningful relationships, reduces feelings of burden, and promotes mental resilience. Comfort is another essential outcome of daily hygiene. Seniors who skip regular cleaning may experience skin irritation, itching, dryness, or discomfort in private areas or on the feet. Even mild issues like sweaty skin, bad breath, or greasy hair can cause unease that lingers throughout the day. These small discomforts, when multiplied, can greatly reduce enjoyment of life. Daily hygiene routines, bathing, brushing teeth, cleaning sensitive areas, trimming nails, wearing fresh clothes, remove sources of irritation and replace them with a sense of freshness and relaxation. A body that feels clean is easier to live in, easier to rest in, and easier to move with. Comfort translates directly into better sleep, greater mobility, and higher energy levels, all of which are vital for seniors who want to maintain independence. Quality of life is deeply tied to hygiene because it encompasses both health and dignity. A senior who keeps themselves clean is less likely to face infections, hospitalizations, or complications from poor hygiene practices. For example, maintaining oral hygiene reduces risks of heart disease and cognitive decline, while keeping feet clean prevents fungal infections and mobility issues. Private area cleanliness prevents urinary tract infections that could otherwise become severe. These preventive steps may not seem glamorous, but they ensure that seniors spend less time in pain or hospitals and more time enjoying life. This freedom from health problems adds to their quality of life by allowing them to focus on activities that bring joy: reading, gardening, walking, praying, or spending time with loved ones. Dignity is also at the heart of quality of life. Many elderly individuals fear becoming dependent on others or losing control of their personal care. Hygiene is one of the few daily tasks that directly represents independence. Being able to bathe, groom, and present oneself neatly is a statement of self-respect and autonomy. Even for those who require some assistance, maintaining a routine of cleanliness keeps a sense of personal identity alive. Seniors who feel dignified are less likely to suffer from feelings of worthlessness, and more likely to engage with life positively. Caregivers, too, find that seniors who practice good hygiene are easier to support, because they suffer fewer preventable health complications. This creates a cycle where dignity and independence are reinforced, improving quality of life for both seniors and those around them. There is also a psychological clarity that comes from daily hygiene. A clean body often promotes a clean mind. Seniors who bathe or freshen up regularly often report feeling more awake, alert, and energetic. The act of washing away the residue of the day can also be symbolic, giving a sense of renewal and readiness for tomorrow. Small rituals, such as brushing teeth before bed or washing the face in the morning, create structure and rhythm in daily life. Structure is particularly important in old age, as it provides stability and helps reduce anxiety. Hygiene routines thus contribute not just to physical health but also to emotional balance and a sense of order. Another dimension is self-image. How seniors perceive themselves greatly impacts how they interact with others and how they cope with aging. Cleanliness directly influences self-image, making people feel more attractive, more capable, and more youthful. Seniors who groom themselves daily often report feeling younger than their age, which translates into higher motivation to stay active, exercise, and socialize. They may be more inclined to dress nicely, go out, or meet friends, because they see themselves as vibrant rather than frail. This improved self-image feeds into a positive cycle of better health habits and stronger social connections, both of which are critical for longevity. Neglecting hygiene, on the other hand, can set off a downward spiral. When a senior stops bathing regularly or lets oral care slide, they may begin to smell unpleasant, develop visible skin conditions, or lose teeth. These physical changes can attract judgment or pity from others, which further reduces confidence. Over time, they may stop engaging socially, lose motivation for other self-care habits, and experience declining health. What begins as a simple lack of hygiene can snowball into a much bigger issue, affecting every area of life. This is why establishing hygiene as a non-negotiable daily practice is so vital. It prevents small neglects from turning into major losses of independence and well-being. It is important to note that maintaining hygiene in later years is not always easy. Limited mobility, joint pain, memory issues, or fatigue can make bathing or grooming feel overwhelming. For this reason, tools and adaptations become essential. Shower chairs, handheld shower heads, non-slip mats, and long-handled sponges can make bathing safer and easier. Electric toothbrushes and water flossers can help those with arthritis care for their oral health. Caregivers should also encourage seniors to maintain hygiene without taking over completely, supporting independence wherever possible. Even partial assistance, provided with dignity and respect, helps seniors preserve their confidence and comfort. Ultimately, daily hygiene is not a luxury or superficial concern. It is a cornerstone of health and happiness in old age. Cleanliness supports the body by preventing illness, supports the mind by reinforcing confidence, and supports the spirit by maintaining dignity and self-respect. Seniors who uphold these routines enjoy a greater sense of control over their lives, better interactions with others, and a higher level of comfort day by day. They are more likely to feel proud of themselves, less likely to suffer from preventable complications, and more likely to remain active and engaged. In the end, after 70, life is not just about surviving. It is about living with vitality, grace, and satisfaction. Daily hygiene is a simple yet profound tool that allows seniors to achieve this. It brings together physical health, emotional stability, social confidence, and personal dignity into one powerful practice. Those few minutes spent each day caring for the body become an investment in comfort, freedom, and happiness. They help ensure that the later years of life are not defined by illness or embarrassment but by confidence, peace, and quality living.